Oystercal-D is a combination medication that is used to prevent or treat low blood calcium levels in people who do not get enough calcium from their diets. It can also be used to treat conditions such as bone loss, weak bones, decreased activity of the parathyroid gland, and certain muscle diseases caused by low calcium levels. This medication is important for normal functioning of nerves, cells, muscles, and bones. It helps the body absorb calcium and phosphorus, which is essential for building and maintaining strong bones. It is recommended for certain patients including pregnant or nursing women, postmenopausal women, and those taking specific medications. The recommended daily dosage and optimal timing for taking Oystercal-D should be discussed with a healthcare professional. When taking Oystercal-D, it's best to take it with food. If your product contains calcium citrate, you can take it with or without food. Make sure to follow the directions on the product package or as directed by your doctor. For optimal absorption, if your daily dose is more than 600 mg, divide your dose and take it throughout the day. If you have any questions, don't hesitate to ask your doctor or pharmacist. If you're using the liquid form, be sure to measure the dose carefully using a special measuring device or spoon. Avoid using a household spoon as you may not get the correct dose. For the chewable form, make sure to chew thoroughly before swallowing. If you're taking capsules, swallow them whole. Don't crush or chew extended-release tablets as it can release all of the drug at once, increasing the risk of side effects. Swallow the whole tablet without crushing or chewing. To get the most benefit from Oystercal-D, use it regularly at the same times each day. If your doctor has recommended a special diet, it's important to follow it to get the most benefit from this medication and prevent serious side effects. Avoid taking other supplements or vitamins unless ordered by your doctor. There are different forms of calcium supplements containing different amounts of calcium and vitamin D. Ask your doctor or pharmacist to help select the best product for you. If you think you may have a serious medical problem, seek medical help right away. Some common side effects of Oystercal-D include constipation or stomach upset. If these effects persist or worsen, it's important to consult with your doctor or pharmacist right away. If your doctor has prescribed Oystercal-D for you, it's because they have determined that the benefits outweigh the potential side effects. Most people who use this medication do not experience serious side effects. However, it's important to notify your doctor immediately if you experience any of the following serious side effects: nausea or vomiting, loss of appetite, unusual weight loss, changes in mental or mood, signs of kidney problems, bone or muscle pain, headache, increased thirst, increased urination, weakness, tiredness, or fast/pounding heartbeat. While a severe allergic reaction to Oystercal-D is rare, it's crucial to seek medical help if you notice symptoms such as rash, itching or swelling, severe dizziness, or difficulty breathing. This is not an exhaustive list of potential side effects, so if you notice any other effects not mentioned here, be sure to reach out to your doctor or pharmacist. In the U.S., you can report side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can report side effects to Health Canada at 1-866-234-2345. Before taking Oystercal-D, it's important to let your doctor or pharmacist know if you have any allergies to vitamin D products or other ingredients in the medication. You should also share your medical history, especially if you have conditions like high calcium/vitamin D levels, difficulty absorbing nutrition from food, kidney disease, liver disease, certain bowel diseases, or diabetes. If you are pregnant or breastfeeding, it's important to consult with your doctor before using this medication. It's also important to note that chewable tablets may contain sugar or aspartame, so if you have conditions like diabetes or phenylketonuria, you should talk to your doctor or pharmacist before using this product. When it comes to the daily dosage and optimal timing, it's best to follow your doctor's recommendations. And as always, it's important to discuss the risks and benefits with your doctor, especially if you are pregnant or breastfeeding. When taking Oystercal-D, it's important to be aware of any potential interactions with other medications. Some drugs, like digoxin and phosphate binders, may interact with Oystercal-D, affecting how it's absorbed in the body. Calcium can also decrease the absorption of other drugs such as tetracycline antibiotics, bisphosphonates, levothyroxine, and quinolone antibiotics. It's important to separate the doses of these medications as far as possible from your doses of calcium/vitamin D and ask your doctor or pharmacist for help finding a dosing schedule that will work with all your medications. Be sure to check the labels on all your prescription and non-prescription/herbal products, as they may contain calcium, phosphate, or vitamin D. Also, avoid using medications containing calcitriol while using vitamin D, as they are very similar. Additionally, Oystercal-D may interfere with certain lab tests, so make sure to inform your lab personnel and doctors that you use this product. It's important to take these factors into consideration to ensure the safe and effective use of Oystercal-D. If you believe someone has taken too much Oystercal-D and is experiencing severe symptoms like passing out or difficulty breathing, call emergency services immediately. Otherwise, contact your local poison control center for assistance. In the US, you can call 1-800-222-1222, and in Canada, reach out to your provincial poison control center. Signs of an overdose may include nausea, vomiting, loss of appetite, changes in mood, headaches, drowsiness, weakness, and tiredness. Remember to keep all medications out of the reach of children and pets. Remember to schedule regular medical tests while taking Oystercal-D, especially to check your calcium levels. It's important to keep all your medical and lab appointments, and consult your doctor for more details. To naturally increase your vitamin D intake, consider adding fortified dairy products, eggs, sardines, cod liver oil, chicken livers, and fatty fish to your diet. Your body also produces vitamin D when exposed to sunlight. For calcium, focus on consuming dairy products like milk, yogurt, cheese, and ice cream, as well as dark green leafy vegetables such as broccoli, spinach, and bok choy. You can also opt for calcium-fortified foods like orange juice. To reduce the risk of bone disease, stay physically active, avoid smoking, and limit alcohol and caffeine intake. And remember, Oystercal-D is most effective when taken at the recommended daily dosage and at the optimal timing. If you forget to take a dose of Oystercal-D, take it as soon as you remember. If it's almost time for your next dose, then just skip the missed dose and take the next one at your regular time. Don't take double the dose to make up for the missed one. Remember to store Oystercal-D at room temperature, away from light and moisture, but not in the bathroom. Keep it safely out of reach of children and pets. When you no longer need it or it's expired, make sure to properly dispose of it by consulting your pharmacist or local waste disposal company. And don't flush it down the toilet or pour it into a drain unless instructed to do so. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.